Hey guys, welcome back to the channel, and today we're going to be reacting to
Why poor Europeans live longer than rich Americans.
Imagine living poor, but still outliving the richest people on earth. That's exactly what poor Europeans are doing compared to wealthy Americans. Let's uncover why. Today, we're exploring how wealth doesn't guarantee a longer life, especially if you live in the wrong system. We'll start by looking at the data behind this longevity paradox, then break down the reasons Europe
I
consistently.
think it really boils down to the simplest, just the poorer people are more active than the rich. I think because as a poor, you probably work like a physical labor job. You have to, move a lot, walk to work sometimes if you don't have a car. When you're rich, you kind of sit more. You're not physically active when you're rich. Like a lot of rich people are just fat because they don't have to move a lot. So to me, I think it's not even rich Americans versus poor Europeans, it's rich versus poor. I think poor people, like I cannot say for a fact that poor people outlive the rich. I don't know that, but if that was the case, I would think it's for the simple fact that the rich are more sedentary than the poor.
Beats the US, from healthcare to lifestyle to inequality, and what that says about the deeper structure of society. I'm Elle. I write about the hidden architecture of society, why some people thrive and others just survive, even when they've both made it on paper. Let's begin. How is it possible that the richest country in the world doesn't buy its citizens more years of life? In a landmark 2025 study by Brown University researchers, nearly
what
74,000
year?
adults aged 50 to 85
2025, April 2nd. It's fresh.
Ooh.
across the US and 16 European countries were tracked for up to 10 years. The results were
Mm.
absolutely stunning. Americans at every wealth level had higher mortality rates than Europeans, including the top 10% richest Americans. Rich Americans didn't outlive their European peers. They often died before many Europeans with modest wealth. In fact, the wealthiest 25% in Northern and Western Europe lived approximately 35% longer than the wealthiest Americans. Meanwhile, the richest Americans had survival rates comparable to the poorest Europeans in those regions. That's right, even after accounting for
I would like
enormous
to see
personal wealth,
some examples.
I hope she's gonna show the data.
Yeah, that'd be
wealthy
really
Americans die
interesting.
younger, a sobering illustration of a systemic failure. It's not just poverty that kills in the US. Wealth doesn't protect as much as it should, or we thought that it does. At the same time, health inequality, the gap between rich and poor mortality, is steeper in the US, showing that the US system punishes poverty more and protects the wealthy less effectively. So, what is Europe doing differently? Let's start with the most visible differences: universal healthcare. In countries like Sweden, France, and Germany, and basically anywhere else in Europe that I can think of, your access to a doctor doesn't depend on your employment status, your insurance paperwork, or the generosity of strangers
Yeah,
pouring.
that's fair. I think that's the ultimate equalizer in terms of wealth, right? So
Mm.
when your health, like no matter how rich you are, you have the same
Mhm.
like healthcare, like that basic healthcare. So I think that's fair.
GoFundMe. It's not a market commodity, it is a public good. The assumption is simple: if you're sick, you get treated. No deductibles to decipher, no out of network surprises, no financial roulette every time you visit a hospital. And here is the part that really complicates the American narrative: Europe spends far less per capita on healthcare than US and gets better results. We're talking longer life expectancy, lower infant mortality, fewer preventable deaths, and significantly lower rates of medical bankruptcy. Even wealthy Americans aren't fully protected. Sure, they have access to top tier clinics and private options, but they're still trapped inside a fragmented, profit driven system. Even with money, you're navigating narrow networks, opaque billing codes, and unpredictable coverage. Treatment can be delayed, misrouted, or denied outright, not because the resources don't exist, but because the system is disjointed by design. And healthcare is only part of the equation. European countries surround their citizens with a dense, interlocking web of public support that stabilize life well before things go wrong. Paid parental leave, often
Mm.
lasting a year or more, guaranteed vacation, often 5 weeks minimum, rent subsidies to cap housing stress, progressive taxation and direct income redistribution. This is an ideology, it's not some utopian socialism. It's structural foresight, a clear eyed recognition that the health of a nation depends on more than what happens in hospitals. When people have time to rest, recover, raise children, and pay rent without panic, they get sick less. Shocker. And when they do get sick, they heal faster. That's why the health gap between rich and poor is narrower in Europe. It's not just that care is free, is that life is less destabilizing and therefore less stressful. The system is designed to reduce damage before it spreads. In the US, the idea is wait for collapse, then try to triage. In Europe, the emphasis is on upstream protection. Compare that to the US, where a teacher in Texas might skip insulin to afford rent, while a CEO in California still battles
so
burnout, poor air
sad.
quality, and overprescribed medications from a healthcare system that costs more but delivers less. This isn't a debate about efficiency anymore. It is a debate about human values. If
But
you
I would
want
love
more
to see
breakdowns like
stats. I want to see the stats.
this, hit subscribe.
I don't think she's gonna show the stats. We passed that kind of.
It gets smarter from here. So let's talk about the lifestyle gap. Why are Americans rich or poor, sicker, younger?
So
One
is she
major
quoting
explanation-
the study? The study?
That's how I understand. I understand she's basically basing this video on a study. Yeah.
Chronic disease remains the dominant health crisis in the US. Now,
Does she have the link in the description or no? No.
drives more early deaths than any other category. As the Wall Street Journal reports, chronic disease has become the biggest health threat, pushing down life expectancy and overshadowing decades of gains. Drivers include obesity, poor nutrition, inactivity, and fragmented healthcare that prioritizes treatment over prevention. Despite advances in medicine, Americans are living.
I think inactivity is a big one that people underestimate a lot. I think that's a very big one. It's just people being more active. Like in Europe, they are more active because, you know, they walk more. And here, people take the cars more. That is a fact, you know. And I think that because, you know, you're less active, you weigh more, you're fatter, you know, because you don't burn calories and you still eat. And it's just, it all adds up, you know.
Living longer, but spending more of those years in poor health. In 2021, only about 83.6% of life expectancy was lived in good health, and chronic conditions continue to rise unchecked. In comparison, many European countries fare much better. Life expectancy in the US sits roughly at around 78.4 years, whereas peer nations like Germany, Sweden, Canada, and Japan average around 82.5 years, a gap of more than 4 years, despite the US spending far more per person on healthcare. American adults are nearly twice as likely to have multiple.
I think they spend more on healthcare because people are less healthy. Like, you have to spend more because there's more health issues. So to me, that makes
They get
sense.
neglected.
Yeah, like you got. So they do have to spend more because people are less healthy. That's pretty common sense, no? If people were healthier, they wouldn't have to spend as much, and that's what Europe has. Europe has healthier people, so they don't spend as much. I think that's pretty common sense. I don't know why she's acting so surprised.
Chronic conditions compared to peers, with obesity rates among the highest globally. Nearly 42% of US adults are classified as obese, a rate that dramatically outpaces other wealthy nations and drives preventable deaths. What underlies this? Lifestyle and environment play big roles. Europeans tend to walk more. Cities are denser, public transport.
It's an interesting video. I like the concept. I just wish we got to see a little bit more stats. Like, for example, the obesity too. I'd love to see the actual numbers, how American obesity being compared to European obesity.
Because most of this information is like common sense.
Yeah,
like,
but
straightforward.
exactly. But I would like to see the actual numbers.
Transit is common.
Because, like, you know, if American obesity is, she said, like 32%, I think, and if European is 30%, like a 2% gap is not that big. But if European is 20%, American is 32%, okay, there's a big difference. I would love to see that, for example, because we have seen the obesity in Europe is increasing too. So it's not like Europe doesn't have obesity problem.
And daily life often involves movement. Americans rely far more on cars, reducing baseline activity.
Start earning greater at ozk.com or a branch near you.
Diets differ too. Less ultra-processed food, stricter regulation on additives, smaller portions, and shared meals, all correlated with lower rates of obesity and diabetes. Americans also work longer. On average, US workers log 1,811 hours compared to about 1,500 hours in Northern Europe, an extra 6 weeks a year spent working instead of resting extra.
But why are we cherry picking Northern Europe now? Not the whole Europe.
So is a study based on all
No,
of
no,
Europe?
study based on all Europe, but this stat she cherry picked for Northern Europe because clearly the all Europe doesn't fit the narrative. I don't like that.
Exercising or eating well. Even wealthy Americans with access to fitness tech and wellness fads are still embedded in a culture of overwork, bureaucracy, stress, and medical complexity. Meanwhile, a middle-income Dane may not have a luxury budget, but benefits from universal healthcare, generous paid time off, and a society that makes rest a norm, not a perk. That means less stress, better early detection, fewer chronic conditions years later. So it basically comes down to questions like, would you rather have a mansion or 10 more years with your family? Let me know in the comments. Would you move to Europe if it meant living longer? So let's talk about a little bit of science.
That's an
Can
interesting
money buy
question.
wealth? Well, to a point. Enter the
Yeah.
Would you rather live in a mansion or 10 more years of life? If I have a mansion, I can guarantee myself 10 more years of life. Like, take out the stress. I will walk around in the mansion,
The
exercise in the
thing is, it's
mansion.
not such a straightforward,
Yeah,
right?
it's like so
Because
many factors
so
into
many
thing. I
factors,
don't
right?
know.
Because would you rather live in a mansion than 10 years? Right. What are the 10 years extra looking like? You know, like,
I don't want to be.
yeah, like are 10 years extra good years or 10 years extra, just like I'm the poorest person of the poor, like it's a lot of variables.
Preston curve, a well documented relationship between a country's income per capita and its average life expectancy. What it shows is revealing. At low income levels, increases in wealth lead to significant gains in lifespan, but once basic needs are met, further income yields diminishing returns, especially if that wealth isn't coupled with public health access or social cohesion. That's the concave shape at the heart of the Preston curve. And this helps explain why the US, despite its staggering national income, often underperforms on longevity, even compared to countries with substantially lower GDP per capita.
I will say though, yeah, the American life expectancy is a little bit embarrassing.
What is it?
It's like I think 78 years.
Wow.
Most of Europe is 80 plus, like 82-ish. So that is a little bit embarrassing for a developed nation. I will say that it used to be higher before COVID, but so was Europe. Everybody's went down during COVID, but yeah,
Wow.
it is that number is embarrassing for America.
More money doesn't guarantee more life unless institutions invest in shared well being. The real killers, drumroll, of course, income and wealth inequality. The US has some of the highest income inequality among wealthy nations. That gap matters not just for fairness, but for health too. As researchers Richard Wilkinson and Kate Pickett argue in The Spirit Level, health and social problems are far more common in unequal societies. These problems ripple through mental illness, obesity, drug misuse, child health, and even homicide rates. The social mechanisms make this more than theoretical. Inequality erodes trust, it weakens social cohesion, it concentrates stress not just on the poorest, but across all of society. That stress manifests not in famine or disease necessarily, but in higher deaths of despair, suicides,
Yeah, I think we're past of the point of famine and disease in modern society nowadays. That was relevant. Well, it's still relevant in some countries, in third world countries, I'm sure it's relevant, but in first world countries, I think we're past that point where that everybody has access to, like, we have vaccines to prevent like basic.
There's here in the States we have food deserts. Like, remember, there's like places where companies cannot travel effectively to bring good produce. Rather, they can only bring preservative
I remember.
goods.
I remember.
So
that.
I think when we consider what famine is, I think also the quality of food that is sent to a specific location.
Yeah,
Because in
we can talk
Mississippi,
about it.
they don't eat too well because it's not an ideal location for these trucks to go deliver healthy, good foods to.
Now that you bring that, also would be interesting to see, because America is such a big country, to kind of compare Americans versus Europe. I guess America versus Europe is fair, versus the continent versus just America, because America is almost like a continent. But would be like, I think would be more interesting to see state by state for me, because I think it would vary heavily in the southern states, the Mississippis and them, versus Colorado's, California's, New York's, Florida, Washington State. I just think those states would be a little better. But I would love to see the data to see if I'm right or wrong, because I don't have any data to back that up. It's just kind of my gut feeling.
overdoses, alcohol related tragedies, life expectancy falls not by scarcity, but by disconnection and psychological collapse. In more equal European countries, thanks to progressive taxation, general public services, and redistributive policies, these gaps compress. A middle income Norwegian may not own a yacht, but statistically, they're much more likely to reach age 85 than a comparably wealthy American. That's a different kind of wealth altogether. If you're still here, thank you. This video took several days to make, so if you'd like to support more work like this, there's a Ko-fi link below. And if not, just like this video and subscribe. The House of L is a community of thoughtful, clever people, and you're very welcome here. So here's the truth. Yes, money helps. It buys better food, safer neighborhoods, and access to services. But if your country lacks universal healthcare, paid leave, and a baseline of equity, even money can buy you time. Not really, because when the infrastructure of care is missing, individuals are forced to compensate, and even wealth has its limits. In the US, your zip code can subtract up to 15 years of your life expectancy. The air you breathe, the hospital you live near, the schools your kids attend, all of it is shaped by geography. And in the US, geography is destiny. And yet we still treat
And
wealth
it's
like immunity.
systematic too, because we have like systematic laws on how we design our neighborhoods that can determine what's your life going to look like in the next 20 years.
Like if you just work hard enough, earn enough, optimize enough, you'll be safe. But the data says otherwise. The richest Americans still die younger than many modest income Europeans because it's not just about what you can afford, it's about what your society guarantees. Europe shows us something different. When a society invests in everyone, not just in productivity, but in protection, the results show up not just in GDP growth, but in birthdays, in fewer funerals, in lives that are longer, healthier, and less fragile. That's not utopian, it is just design. So ask yourself, would you rather earn more or live longer? Maybe the US.
Also, I wonder, do genetics play a role? Like, do Europeans live longer? Because genetically they live longer, right? Like, they have better genes, more longevity genes, and they just live longer. Like, I guess take a European and put it into America. Would they live as long as they would live in Europe, or would they live shorter? That's something I don't think we're gonna ever get an answer, because I don't know how you would measure that, like how long the study would have to be, and like how. But
You know,
that is an
when
important
the
question to ask.
Europeans came to the States, they wiped out the Native Americans
Yeah, I know.
because of, the sickness they
Yeah, they
carry,
carry. Yeah,
that they carry. So it didn't affect them,
Yeah.
but it affected Native Americans who,
Yeah.
who just live and eat off the
Yeah.
land like
Yeah.
a natural diet.
Yeah.
So I don't know, maybe over time in evolution, the genes of what makes your body susceptible to, or what it makes it like strong against, I think plays a factor because that's not good.
Right. So that's what I wonder. Like, are Americans, okay, like a lot Americans essentially are coming from everywhere else in the world, but when they live generation, the genes modify a little bit. So does that affect? It's just, I guess my point is, would you take a European who would otherwise live in 82 years, put it in America? Would he or she still live 82, or would that age go down to
I
78?
notice like when your family comes, like their stomachs is not quite adjusted to the foods, so they get sick and they reject
Oh,
it.
but would be the same thing for you to go to Europe.
Yeah,
It's
yeah,
just
yeah,
different
yeah.
bacteria.
Yeah.
That
So
that has
if
nothing
I
to do
think
with
that
anything.
no, but to talk about the bacteria,
Oh,
that's
the
what's
bacteria.
protecting you.
Yeah, I just wonder, because if does that matter? Because we can sit here, blame the system a lot, all that, but at the end of the day, is it the system, or really it just boils down simple to just genetics? Because we say all these things. Oh, smoking kills. Is that there's people who smoke all their lives, live till they're 100. What does that say? You can do. There's people that do everything right to prevent themselves from whatever. Like, by the book, they die at 40. Then there's people who don't care, could not care less, and just live whatever, do whatever they want to do. They live till 90.
There are exceptions.
No, I'm just saying, like, genetics matter, but on average, because you say this exception's fine, but on average, how much genetics matter too? That's the closing thoughts for the video.
Guys, of course, let us know your thoughts. Don't forget to like, comment, and subscribe. Join the Discord. And as always, share as much kindness as possible.